Here with me now is one of the president's top medical advisors, CMS Administrator, Dr. Mehmet Oz. Thank you so much for being here. I do want to start with TrumpRx. It is intended to lower the cost of prescription drugs. Right now, the site only lists 43 drugs. A lot of them are also available at the same discounted prices through pharmacies or on sites like GoodRx. So what does TrumpRx do differently?
Well, let's take a step back. When the president entered a year ago, he lamented the fact that we're paying 3 times more, all of us, 3 times more for the exact same medications made in the same facilities, often in this country, than the Europeans are paying. And it's wrong. And so he insisted that we develop what's called most favored nation drug pricing, which means no one else gets a better deal than America gets. We already pay for a lot of the research, but at least let's get the benefit when our people have to buy these medications. Remember, 1 in 3 viewers right now, when they go to the drugstore, they don't pick up their medications because they're sticker shock. They can't afford it. So we negotiated with all the major drug companies, most favored nation drug pricing. It was not easy, Dana. You look them in the eyes and you say, this is wrong. You got to do something about it. And God bless them, all the pharmaceutical companies came to the table and were willing to make these arrangements. But how do you get those deals to the American people? You got to start somewhere. And so the TrumpRx.gov site is an effort to allow anybody in the country, if they desire, and we're starting with cash paid customers, they're our most vulnerable folks. There are probably 27 million people in that category. But ultimately, it drives transparency into the entire system. Now, we started with 43 medications, and some of them do have generic equivalents, and all of that's going to be part of this broader push to make sure that you know that before you buy a medication, go check the site, make sure you're getting the best price possible. You don't have to use the site. It's free, by the way. I think many people will use the site. We've already had millions of people, unique individuals, come to the site, tens of thousands of prescriptions already downloaded. You can take it to a local pharmacy, to a mail order pharmacy, sometimes get it directly from the manufacturer. We're agnostic to that. But I'm going to bring one big important point here. You got to start with a core group. The person who designed the site, Joe Gebbia, founded Airbnb. That's the kind of massive talent you bring in. He didn't start with every apartment in the country. He started, or the world, he started with a few. And Ed Korstein, who designed it, wonderful engineer, they wanted to make it work perfectly the first time and then build on top of it, which is what we're going to do.
Okay, so it's a building block. And you said, and this is important, this right now is intended to benefit people who don't have insurance to help pay for prescription drugs. But nearly all of the drugs right now on TrumpRx are widely covered under insurance. So the fact that you have on the website a warning that says if you have insurance and copay, go check that out. So the question is, how is this going to help lower prescription drug costs for everybody eventually, including those who have insurance?
So let's take a couple of specific examples. Let's take the weight loss drug, right? The GLP-1 medications.
Well, that's in a lot of cases not covered.
Exactly. That's often not covered by your insurance. Even like here at CNN, I don't know if you're covered, but there's about a 50-50 chance you're not for all your employees. And so if you're covered with insurance for the GLP-1 drugs, you're going to use that insurance because it's less expensive to you. But the employer, CNN, will look to see the price on the website's lower than what they're actually getting from the middleman that's reselling the product. They're going to say, I don't want that. I want the better price. And you, Dana, if you desire, because you don't have the insurance for whatever reason, to buy it on your own, you can buy it for a price now. It's about $150. By the way, there's a weight loss pill now, not just an injection. You can now get that pill for $150 bucks. These are instead of over $1,000.
That's an example of a drug that isn't covered in a lot of places where you could on TrumpRx get a lower price. My question is, the majority of people in this country are insured, but even under that insurance, prescription drugs they're still very expensive, and this doesn't address that problem.
Oh, it does address it because over time, as we add more and more medications to the list, all of those prices come down. And there are some categories, take the fertility drugs, where it's a 90% reduction in cost. That's a place where most Americans don't have insurance coverage. There are others like asthma medications when they're covered, but when the employer sees that the drug price that they're paying through the middleman is twice as high as what TrumpRx is offering to the cash pay customer, they're going to assist.
So you're saying it's incentive. Okay, let's talk more broadly about the root cause of these skyrocketing healthcare costs for a lot of Americans, and that is because the premiums that low-income Americans were getting are now expired. This is as part of Obamacare. You told me here in November that the president is laser focused on this. So far, we've only seen a framework of a plan. What specifically is the president doing right now through the fundamental problem with insurance costs to lower those costs?
Dana, let me just, if I can, add one thing to something you said earlier. If we've seen in the ACA marketplace where there was a baseline 83% subsidy, that when you take away the extra 5%, which is what the enhanced premium subsidies represent, it doesn't really affect enrollment. In fact, we're still roughly at around 23, 24 million people. And that's despite the fact that all the fear mongers were saying we're going to lose 8, 10, 12 million people. No one seems to have left the exchange.
But that doesn't speak to the cost. The costs are still high. So my question is, just can you give me one specific example of a solution that the president has put forward that is lowering the cost of health insurance and healthcare costs beyond prescription drugs?
There's something called a CSR, which is a way of making sure that insurance works more efficiently. The Affordable Care Act is a good example of this. These were in the original Working Families Tax Cut legislation, was taken out by the Democrats for reasons that are unclear to me because it seems like it's better for everybody. It will drop premiums 10 to 11% across the board. So I'm giving you a insurance hack that works to reduce insurance premiums for the American people 10 to 11%. We want it back in. We want that to, it was originally designed and supposed to be in the Working Families Tax Cut legislation. We want that back. The other thing, Dan, is transparency is vitally critical. When I'm called into the operating room, and I'm a surgeon, as you know, the first thing we do, if I'm helping a colleague, is we open the wound and put more light in the wound. Transparency, we got to see what we're doing. Most Americans don't really know what they're paying for. Their pharmaceutical prices are an example, but when you go to the hospital, you don't know what it's going to cost you.
Right.
You would never go to a grocery store and put things in your cart and not know what they were going to cost. And that's what we ask the American people to do. And of course, because of that, companies jack up the price because you're not aware, you're not an informed consumer. We have to drive transparency to the system, so we use our biggest ally, the American people, to judge whether the prices are worth it or not.
Speaking of transparency, I do want to, before I let you go, ask you about a record surge in measles in the United States. South Carolina, for example, is currently reporting 800 cases. It's the worst outbreak since measles was declared eradicated more than 3 decades ago. Is this a consequence of the administration undermining support or advocacy for measles and other vaccines?
I don't believe so. We've advocated for measles vaccines all along. Secretary Kennedy's been at the very front of this movement.
Come on.
No, he is. When the first outbreak happened in Texas, he said, "Get your vaccines for measles because that's an example of an ailment that you should get vaccinated against." What happened with the core schedule that was released in the beginning of last month was to say, listen, we look at what happened in Europe. In Europe, if you give people 80 different vaccine doses to take, people start.
But I'm specifically talking about measles here. I mean, you talked about RFK Jr., the group Children's Health Defense that he founded and ran up until 3 years ago, posted on X, despite the media's scare tactics, there's no reason to fear measles. Should people fear measles?
Oh, for sure. And we actually are pretty aggressive at CMS. We fund any vaccine you want to take. There will never be a barrier to Americans get access to the measles vaccine. And it is part
as
of
a
the core
doctor,
schedule.
your message to people about the measles vaccine
Take
is?
the vaccine, please. We have a solution for a problem. Not all illnesses are equally dangerous, and not all people are equally susceptible to those illnesses. But measles is one you should get your vaccine.
Dr. Mehmet Oz, thank you so much for being here.